You may think ozone is bad when thinking of our environment, but not be aware that this supercharged form of oxygen is actually a wonderful miracle worker when it comes to healing the body. This easy to use at-home healing tool has health and healing benefits to deliver for almost every disease, from hair loss to arthritis to chronic infections like Lyme and to autoimmune disease. And you won't find this at your typical doctor's office. In today's episode, Micah the Ozonaut will share the basics of ozone therapy with you, what it is, what it can help, and how to get started. Hey everybody, it's Dr. Kieran. Welcome back to another episode of Her Brilliant Health Radio. Today my guest is Micah the Ozonaut. Micah Lowe is known as Micah the Ozonaut. He's passionate about promoting the use of a super-powered form of oxygen called ozone to heal your health and create vitality. He is the voice of Doctor's Ozone, which is a platform designed to educate doctors and lay people alike about current use of ozone for health and healing. His blog, YouTube channel, and podcast all serve as wonderful resources for those seeking true health and vitality. Micah is also the founder and owner of Simply O3, the first company to provide economic and reliable ozone generators for use by clinicians and clients alike, and Honest O3, which provides high-quality ozone-infused skin and tooth care products. I'm so excited to have Micah Lowe on the podcast today. Welcome, Micah. Hey, welcome, Micah. How are you doing?
I'm doing good. Really excited to be on here and talking to you.
Yes, Micah the Ozonaut. So we are excited to talk today with Micah because he is so passionate about ozone, which is a super form of oxygen that can really benefit your health in a lot of ways you might not be aware of. So let's get right into it and start talking about that, Micah. What is ozone?
So ozone is O3, so it's 3 different oxygen atoms. Oxygen is O2, so it's 1 extra atom onto oxygen. That makes it into an unstable molecule, so it's a really strong oxidant. But for a long time, over 100 years actually, it's been used medically for a number of different things. It started off being used in World War I to treat wounds, because they could put it onto the wound that would basically kill off the bacteria, virus, and potential for creating an infection. And then it would also stimulate healing. So they found it to be really effective pretty early on. And actually, I did research some of the history on this personally and went to the original sources, and I found all the way back in 1874, a Dr. Stoker out of Germany had been talking about the medical benefits of ozone. Now, once you fast forward a bit to the 40s, 50s, 60s, and forward, they started to test around with it, use it with blood, use it with different tissues. Now, we can't breathe it. We don't have any antioxidants in our lungs, so it's going to irritate the lung tissues. But there's actually a lot of different ways it can be used to stimulate beneficial effects in the body. It's what's called a hormesis effect, where we administer something that's foreign to the body and has a slightly caustic effect, but that stimulates the body to work appropriately.
Yes. And so it gives off that extra oxygen, and it can help with inflammation, but it can help with also anti-aging modalities too, because you're getting extra oxygen, which the cells sometimes have difficulty in extracting or getting the oxygen at the levels that it needs into the tissues, correct?
Yeah, so in regards to anti-aging, there's a number of different things it does. So, and there's also a number of different ways to administer it. So you can administer it to the blood. You can do rectal insufflation, or vaginal insufflation. Not as much as fun as doing the blood, but they are pretty effective for ozone therapy. So with aging, one of the cruxes of that is oxidative stress. We start to become more oxidatively stressed as we age, and that starts to get out of whack. So oxidative stress, basically we're supposed to have an antioxidant response. So when you exercise, you're actually stimulating a little bit of oxidative stress. But if your body is healthy, it'll respond with an antioxidant response. And as we age, we become less able to mediate that. So the oxidative stress starts to go higher and higher and higher. And ozone is really interesting because it's an oxidant, but it's able to actually reverse oxidative stress, especially chronic oxidative stress. So a lot of people attribute aging, oxidative stress to be a major cause of aging and inflammation. So if you can find a way to reverse that or mediate it like ozone does, you're going to have a lot of benefits.
Right. So let's talk about some of those benefits. There are myriad benefits to using ozone therapy. And as you mentioned, you can use it intravenously. You can use it rectally, vaginally. You can use it in the ear. You can use it on the skin. You can infuse it into topical products for creams. You can use it lots of different ways. And so what are some of the benefits of using ozone therapy?
So without getting into some of the biochemistry, and we have articles on that and actually what it's doing within the body, and that's typically where I like to start because that gives you a better understanding of what it's actually doing. But if you were to pass over that and just go to what are the benefits people usually experience, say you're a healthy person, usually it's an increase in stamina, a decrease in brain fog if you have any. It's just an overall sense of well-being because we're stimulating not one specific process in the body, not one specific thing like a drug would do. A drug would go in and either shut off a receptor or turn on a receptor or make a certain cell dump something. But ozone actually stimulates on a very fundamental level. And so when you're doing that, you're just promoting the body to work as it ought to. You're promoting homeostasis. So depending on what you got going on, when you're reining in your body into homeostasis, you're going to notice benefits in a lot of different areas. But the biggest ones definitely being increase in energy, a reduction in brain fog, and an increase in stamina. So if you go and work out, you might notice that you'll feel pretty good for longer than you typically would.
Right. And so I know sometimes athletes are using it to improve their stamina and capacity. And what type of healing modalities does it help? What types of diseases has it been used for?
Well, again, because it's so fundamental, it's actually used for a lot of different things. The top ones I would say would be cancer, Lyme, autoimmune, and infectious diseases, including Lyme. So those are really kind of the top things that it's used for as far as medically. But the list, there's an article on doctorsozone.com is really quite extensive because it's just working from a lot of different angles. And it's not the ozone going into your body and forcing the reaction. It goes in, it stimulates the body, and it gives it a little bit of a slap and says like, hey, you need to wake up and do what you're supposed to do. And when the body responds to that, it just lays a foundation that's very helpful.
Yeah, I've used it with patients with Lyme and chronic infections, chronic viral infections, chronic fatigue. Probably most commonly, those are the applications. But it also helps a lot with anti-aging and stamina and things like you said. How did you get interested in educating about ozone and providing ozone equipment?
Yeah, so it started off in high school. I helped my dad to develop something called a UBI device, which is ultraviolet blood irradiation. And that's, again, kind of a fundamental therapy that people are using. They're typically using it for infectious disease. But that started to gain some traction once it got noticed from Dr. Hamlin at Harvard Medical, and then it got approved in Europe as a medical device. And I was kind of looking for things to do. So I started off with nursing. I was an EMT, so I was working on the ambulance for a little bit and working in a pharmacy. But I really noticed just a difference in the way I thought about or what I was passionate about and what that conventional system was doing, which isn't, it's not bad. Medicine is medicine. So if it works, it works. But I think a lot of this stuff were symptom coverages. So like I was saying earlier, one of the biggest things I noticed was just I would ask a question, like in this one in particular was like, so people with diabetes, once they get diagnosed, we start prescribing them metformin. And then we just basically increase the dose over the course of their lifetime. Why not, when they initially get diagnosed with diabetes, create like a 6-month plan? So we give them metformin for 6 months, but there's also a off-ramp. So there's a way to reverse that diabetes diagnosis and through lifestyle changes and those sorts of things. So that was my question. And to questions like that, and that one in particular, the response was, well, we haven't made a drug for it that cures it yet. And it's like, well, that doesn't make any sense because you may never come up with a drug. We have something that works, which is lifestyle change. So why wouldn't we try to encourage that? And I think doctors do, but if you go to a hospital, you can really read what or see what they value by the food that they feed you and the things that they do. I mean, you go to a hospital and, hey, you want chicken tenders and cheesecake. That doesn't make a whole lot of sense to me, and I think they're just trying to cater to people and make it easier. But the reality is that health, especially if you're sick, is a discipline. So I really valued the lifestyle changes that are required for health and maintaining a healthy lifestyle. And I started to get into ozone. So the reason I got into ozone, though, was because a lot of the doctors that use that UBI device that I developed with my dad were using ozone therapy. So I started getting into it, and I was like, kind of, what is this thing? An oxidant that reduces oxidative stress. That's kind of interesting. It doesn't make any sense. And I started to read on it, and I also started to develop equipment with that. And, over the course of a few years, just got really passionate about it and think that people should know about this option. Not that they have to buy into it. I really don't care, but I think it should be out there and people should be aware that this is something that you could use for your health.
Yeah, I think that it's a very important to raise the level of awareness about this tool. I think that people, one, aren't aware, and then if they are aware, they think that it's something they have to get at their doctor's office. But I know that your generators are very economical, reliable sources of equipment, and I have one of your generators, and some of the others are extremely expensive. And you kind of democratizing people's ability to purchase this equipment for themselves gives them the power to have this in their home and use it as a tool for healing and promotion of vitality on a regular basis. So I love that, and it makes sense that you discovered this by working with what the technology that you and your dad had developed, because those doctors do work with ozone and use it intravenously. One thing I'd like to highlight for everyone to understand is that the rectal insufflation, and Micah has a great video on YouTube where he says, yes, I said it, rectal insufflation. So we do kind of need to get over ourselves about saying rectum or putting things in our rectum, because it's a great way to administer medications and treatments that can really give you a lot of benefit and avoid harmful pharmaceuticals. So you can infuse the ozone with a small catheter that you hardly even feel. It's almost like a thermometer size if you're taking a rectal temperature into the rectum. And because there's such high vascularity in that area, it readily absorbs the ozone and actually goes right up to the liver through the portal vein. So it has a lot of health benefits in that way, but it goes directly into your bloodstream. So it has the efficacy, I think it's about 90-95% compared to intravenous administration, without having to go to a doctor's office, without having to get stuck with a needle, which I hate more than anything, without having to have the expense. And so it really puts the power in your house, and all you need is an oxygen tank, and you can be using ozone by rectal insufflation right away. So it's ozone for the people.
Yeah, I think it's a good thing. And, like I said, rectal insufflation, kind of get over it, disassociate the stigma associated with doing those kinds of things, and evaluate, is this a good treatment for me to do? Same with like exercise. You don't necessarily enjoy it or want to do it, but what are the benefits thereafter? So I think it's a similar thing, and that we just need to be able to disassociate some of the stigmas as tied to that, and just do things that are beneficial for us.
Right. And I have quite a few patients who have generators, and they use it rectally on a daily or weekly basis. And a lot of times if they have chronic Lyme or Epstein-Barr or some viral problem, or they have chronic fibromyalgia, they can really, it's amazing by how much they use the ozone will really determine what level of functional capacity they have. And then another way that I'm really interested in using ozone is also intra-articular, so in the joints for arthritis. Is that something that you commonly see?
Yeah, a lot of doctors are doing that. So there's primarily, I like to separate, well, first of all, there's two different categories for ozone therapy. There's local treatments versus systemic. Local meaning that it only treats that specific area, which would be like if you put it onto the skin or into a joint. Systemic would be that it's benefiting the body on a systemic level. It's stimulating those fundamental processes. So those are kind of the two primary categories. And from there, there's 4 different ways that ozone is used. There's dental usage for it. So a lot of dentists like it for root canals and cavitations and, whatever's going on in the mouth. There's cosmetics. So there's doctors that inject it into wrinkles along with like platelet-rich plasma to help with wrinkles and hair loss. And there's a number of different things there. There's the injections, which you just mentioned, and that's to help with we'll get into it, a whole variety of things. And then there's medical, and that would be the more like Lyme, autoimmune, infectious diseases. And concerning the injections, basically it can be used in tandem with things. So there's like just ozone gas being injected into a joint. There's ozone, prolozone is what it's called, where they put in a mixture of like protein, B12, folic acid, a number of different vitamins and nutrients that are going to help stimulate the reparation of that joint, but then they'll follow that with ozone. And then there's also the platelet-rich plasma, the PRP, which has growth factors, which are helpful for stimulating regeneration, and they'll mix that with the ozone to accentuate the growth factor in the PRP and inject it in. So basically what happens if the doctors or the claims are that if you inject it into an area with arthritis or a meniscus tear, that it's going to stimulate a healing response by calling growth factor to the area, and it has an anti-inflammatory effect. So if your joint's inflamed, if there's things going on, too much inflammation, a little might be good depending on where you're at. But if there's too much, your blood can't get to that area very effectively. There's not nutrient exchange, there's not gas exchange, and it's just going to continue to perpetuate that cycle of an injured joint or arthritis. And so if you inject the ozone gas in, it's able to calm down that inflammation and also call to that area, hey, you need to heal this up specifically. And so a lot of doctors are seeing, faster healing times, healing response times. There's also, there's a number of studies out there for herniated discs, for instance. So they can inject the ozone gas near the herniated disc. But they actually, you can look on the studies. It's really easy to find. Just Google it, herniated disc ozone therapy or something. And almost always, they're between 70 and 80% success rate with herniated disc, which is about the same as surgery, which is crazy considering that for $400 and a couple doctor visits, you can actually heal that or have a good chance of healing that herniated disc. So I think it's a really good option as an injection. And there's a number of doctors that think that insurance might pick this up in the future because it's a much, much cheaper option than surgery. So if they code for billing prolozone or ozone injections instead of surgery as a first option, it might really start to take off as in its awareness and usage in the system.
Right. Yes. So using it for joints and discs is wonderful. You mentioned for hair loss. Could you talk a little bit about that? I know a few doctors who are using that.
Yeah. So essentially there's the platelet-rich, usually that I'm aware of, they're combining it with the platelet-rich plasma. So they'll pull a little bit of blood out of the body, and then they put that into a cylinder that's going to spin it really fast. And what that does is that separates the red blood cells from the other stuff that's in the blood, which is the platelet-rich plasma, the stuff that has the growth factors and the ability to actually heal things. So basically they separate out that platelet-rich plasma, they combine it with ozone, and that accentuates it's basically now super platelet-rich plasma. It's a much better version of it. And then they can inject that just below the skin into the scalp in a lot of different areas. And it's a very small needle. It's not like a big thing at all. It's like, if you saw it, it's really not intimidating at all. But they just inject it around in different areas. And off of one treatment, you're probably not going to see much benefit. But typically, if they continue to do it, like, 4, 6, 8 treatments, they'll start to see regeneration of hair.
Yeah, so that's a great application. I think they're using it for facials and in-office facelifts, the PRP facelifts and things like that as well.
Yeah, kind of like a natural alternative to Botox, I think, is the easiest way to think about it. But
Right.
Botox, botulism toxin, it wasn't initially made actually for skin issue. What it does is it paralyzes the tissue in your face or wherever you're injecting it so that it doesn't work essentially. But that's not a really good approach to health. You don't want to turn things off that are supposed to be working. And so the advantage with doing like a platelet-rich plasma with ozone approach would be that you're actually stimulating the body to work better. You're not turning
Mhm.
it off.
Right. Yes. And we're all about stimulating the body to function better. So you have brilliant health and vitality. And then talk a little bit about the dental uses. Most people are probably not familiar with that, but ozone is great anti-infective agent. So I know you have a toothpaste in your store. And what are some of the benefits people can expect from using an ozonated toothpaste?
Yeah, so ozone can be used a variety of different ways in the mouth. So there's the ozone gas, and dentists, usually people don't do that at home because you can't breathe it. So you have to have something at the back of the throat to suck it out. But they'll use it during cavitations and surgeries and things like that. That's, going to prevent some of the infections. That's going to help promote the healing. And they just love it. And it also stops bleeding. So if they're doing a surgery, it'll help the blood to clot up better. Which is also another benefit from it. But as far as people that want to just do that kind of stuff at home, typically what they're doing is they're making ozonated water, with the machine and oxygen tank, and there's a way to make it. It's pretty simple. You just let the ozone gas bubble through the water for a few minutes, and then you have ozone that sticks to the water, and people will swish that around. But there's also a way to infuse ozone into oils. And ozone, I didn't mention this earlier, but well, I did. It's very unstable, but it'll actually dissipate and there won't be any more ozone left in the gas within 20, 40, 50 minutes. It has a half-life is what it's called. It reduces by 50% every 30 minutes. So your concentration of ozone will dissipate really quickly. So the advantage of an oil is that stabilizes as an ozonide, which has similar benefits, but that'll last for up to 2 years without breaking down much. So a lot of people like to use that because, again, it's an antiseptic. It kills off the pathogens, and then it also stimulates a healing response. So in the mouth, that can be really beneficial for people who have receding gums, abscesses, cavitations. They can do oil pulling with it. Your teeth are like tubules. They're really not just this dense tissue. It's like a sponge. There's all these tubes and things, and your infection can get down into the tooth where it starts to wreak havoc, and it can be really hard to reach that area. So the reason people do oil pulling is because the infections like the oil, and if you leave it in for 10 minutes, 15 minutes, 20 minutes long enough, the infection will start to gravitate towards that oil. Now with ozonated oil, if you use that, it's a much stronger antiseptic and it actually kills the infection on the spot. So a lot of people are using it more for medical or dental concerns. In the mouth, it can be used as a cosmetic, and people do that just to promote general health of the mouth.
Mhm.
But it's primarily used if there's an issue there. And there's a number of different oils. There's a gel, like I said, you can oil pull with it. You can apply it to the sore directly. There's the toothpaste, which you can just replace or combine with your current toothpaste and brush, twice a day or however often
Mhm.
you do.
Great. So lots and lots of applications. So somebody listening is probably one thinking, oh, I've got gingivitis. I could use that. So I might want to get a generator, or I'm suffering with chronic Lyme and I want to get a generator. Do they have to have a prescription from a doctor to buy a generator?
No, they don't need a prescription from a doctor to just go get a generator. You can just go buy one. You do need a prescription for a medical grade oxygen tank. So a lot of people choose the commercial oxygen because it's easier to get and it's rated for the same grade of oxygen. Um, but yeah, most people are actually doing this stuff at home. I mean, there's a lot of application at the clinic, and sometimes they can do things more effectively, and at least you have doctor oversight. But for people that are convinced of it and really want to continue doing it, it seems like doing it at home might be the best option because it's
Mhm.
much cheaper for what you would pay for, 6, 7, 8 treatments at the clinic. You can get all your own equipment for under $1,000, and it lasts a lifetime. So, I mean, it just works for so many different things like ear infections. It knocks out like right away. So I think just having access to something like that, and
Hmm.
especially in the stead of antibiotics in certain cases, is a really good tool to have in a household. And, we're really not trained that way. We're trained to take 2 pills by mouth per day.
Yeah.
So the idea of having a treatment in your house doesn't, it just is a little bit outside of our paradigm. But if you can equip yourself with tools that are going to be healthy, replace those things, you're actually going to save a lot of money over the course of a lifetime.
Yeah, so maybe in the future it'll be part of our first aid kit, which for me would include things like a neti pot and essential oils and gargling with warm salt water and all the things you can do if you get sick that aren't an antibiotic, because you most likely don't need an antibiotic. So having ozone would be a terrific tool to have in your home medicine chest. So Micah, thank you so much for joining me today. If someone's interested in learning more, where should they find out more about you?
Yeah, there's ask.drzozone.com /free booklet or free guide, excuse me. So that might be a little bit long, but you can go to drzozone.com, drsozone.com. You can find me on YouTube under Dr. Ozone, which again is DRS Ozone. And there's just a lot of information circulating around this. So I know we kind of jumped over a lot of different categories. Typically, I
Right.
like to focus on one or two, because it can get a little bit overwhelming just to hear about all these different things. But I can tell you it actually is really simple to bring into your home to do. It's very practical, and it takes a little bit of work, but couple hours, it's not that much for the benefits you're
Mhm.
getting from it over a course of a lifetime. So yeah, those are the best places to see more information about it is drzozone.com, and on YouTube, Dr. Ozone as well.
Mhm. Yes, so definitely look that up. You can get your free guide at the website. We'll put the link in the show notes. And I do think that it's helpful if people are listening and they want to learn more. Is this helpful for me to get the guidance of a physician who's trained with ozone? Definitely helpful. You do have lots of resources so they can learn more. And I really wanted this to be an intro. What is ozone and what could it possibly be used for? And maybe we'll have you back in the future. We'll talk about more specific applications. I asked all my guests this. Her Brilliant Health is the name of the podcast, and I'd love it if you could share with everyone what that means to you.
Her Brilliant Health, I guess that could mean a lot of different things. I'm sure everybody says something different.
Yes.
I would think simplicity. I think there's a lot of complexity in life, and
Mhm.
boils down to what disciplines can you institute that are going to be healthy and beneficial for you. So find the 3, 4, 5 things that you do on a regular basis that really boost your health, and simplicity is really important in that.
I love that. Her Brilliant Health is simplicity. Thank you, Micah, the Ozonaut, for joining me today. And look for more wonderful products from your company and more excellent YouTube videos.
Yeah, hopefully we get a little bit away from the rectal insufflation. I'm a little bit burned out on saying that, but
Right.
it's information that needs to be out there. So hey, what am I to do? But I really appreciate being on your show. It's been awesome, and I'm looking forward to hopefully we can do this again.
Yes, thank you so much.